on suicide and drug addiction. Whatever statistics with which the authorities provide us regarding suicide and drug-related deaths, we can only assume that the actual numbers are much higher. In many cases, where the cause of death is not disclosed, one can assume that it is likely out of respect for the deceased or to avoid bringing embarrassment to the family. However, it is not the family that should be blamed or shamed. In many cases, they probably did all that they could. Perhaps it is society, our culture and values that are to blame. Manly P. Hall once said in a lecture, and I am paraphrasing, "Drug addiction is an indictment of our society." End quote. People would rather take narcotics and accept all the risks and problems that accompany them than live soberly in our society. The same is true about suicide. One would rather not be here than to burden society with his or her existence, or to be burdened by the social and economic pressures of modern life. Upon watching video after video about drug use in homeless encampments, one realizes that many of these people would rather rob, steal, or sell their bodies to get money for temporary relief in the form of narcotics than experience the discomfort of living soberly in our society. Both drug addiction and suicide represent different stages of giving up. The drug addict doesn't necessarily want to die. He or she usually has a degree of awareness about the havoc the narcotics are having on his or her life. Yet the pressure of life is too great to face, and one may as well get some relief, even if temporary, from drugs. The suicide case is often one who has lost all hope and feels that his or her presence is causing shame or inconvenience to others, or that the pain of existence is so great that he or she would simply rather not be here. What would help these people? The trend of suicide and drug use will only reverse when the values of our society changes. Only when the majority is willing to face their mental and emotional stresses and discomforts head-on will drug use decrease. If we were to value sobriety, care for others, alleviate economic stress, etc., then perhaps there would be a decrease in suicide and drug use. A person who has inner strength, who feels loved, who is surrounded by peers who do not use drugs, etc., such a person would have no occasion for narcotics. However, one who is constantly surrounded by drugs, who thinks that their use is the norm, who is overcome by depression or anxiety, and lives in a world where drug use is glamorized, to this person, drug use is almost inevitable. Religion is perhaps a good way to get out of this rut. People who have some hope that things might get better, either in this life or the hereafter, can likely endure more stress and strain than others without such beliefs. One who believes that there is a cause for his or her suffering and believes that there will be an end to it, or if one believes that God is watching over him or her, guiding and supporting, then this person is likely to be able to endure and overcome more than the atheist who believes that the physical world is all there is. To recap, we should take an interest in those around us and include them in society. We should never glamorize drug use, rather explain to others that their drug use affects us all and jeopardizes the stability of our society. This will only help if the user believes that society is worth caring about. If society never showed any care for them, why should they care about it? We ought to encourage religion and spirituality. Religion brings people together, and those who have a church community are less likely to feel lonely or abandoned. We must address the reasons people are committing suicide and give those at risk a reason to live. People in our communities must have responsibilities beyond his or her job. And we must find jobs for people who are unemployed. People who have nothing to do will ruminate and worry about all sorts of things, real or imaginary. A wandering mind is an anxious one, and a chronically depressed or anxious mind is more likely to commit suicide or become addicted to drugs. The problems of suicide and drug use must be addressed, both at the level of the individual and at the societal level. These problems are complex and deep-rooted. Although they have both to do with mental health, the approach of the last 20 to 50 years of counseling and medication has been unsuccessful at the societal level. There is more drug use and suicide in America now than ever before. Also, the lines between prescription medication and illegal drugs has been blurred. There are black markets for both fake and real prescription medications. There are also celebrity doctors who prescribe illegal narcotics for wealthy clients. Therefore, the values of our country must change, or this problem will go on until it reaches a tipping point. The tipping point is the very health, stability, and survival of our society and the country itself. We need to address the systemic cultural and society values of our country if we are to endure and survive.